In Chapter 13, let's start off with an understanding of why toxicology is different from some of the other things. For instance, we've talked about the drugs and how drugs get detected, and toxicology is a little different. So let's discuss the whys. As you know, when we were in Chapter 2 and we were doing physical evidence and crime scenes, there was a lot of discussion about, and even Chapter 1, what lab unit would you send stuff to? It was kind of confusing. Where do you send things? When do you send things to toxicology versus to a physical science lab to test the drugs, and the biology lab? So understand that a forensic toxicologist, their job is to detect the presence of drugs and other poisons in the body, and the ones as they affect the body. So in body tissues, body fluids, body organs. And again, this affects forensics, so this is partly in crime labs, but this also affects a lot of medicine. So sometimes these people are in hospitals and other types of environments as well. So the big difference between toxicology and drug identification is that in toxicology, when the drugs enter the body, they don't just stay as they are. The whole reason why drugs have effects on the body is because they begin to react with our body and then they disappear. They get turned into different things. So they have effects on the body and then they change. So I want to detect the drug, but the drug has turned into other things in the process of being in the body. And that's what makes toxicology so difficult. I have to understand not only how to detect the drug, but also what happens in the body when that drug enters in and what does that drug turn into, because maybe I can't test the drug, or understanding that even if I'm detecting the drug, it's not at the original levels because it's been metabolized. And so this concept of these time sensitive, that the drugs are changing with time, adds a whole nother layer to the challenging aspect of being able to detect the drugs.